5 minutes.
Thank you, Mr. Minister. Thanks for being here. Canadian innovators stepped up when asked to solve the shortage of PPE in 2020. Distillers switched to make hand sanitizer and cleaning products. Canadian companies retooled and produced whatever was needed for the pandemic. However, Canadian companies like Eclipse Innovations in Cambridge, Ontario, has millions of respirators sitting on shelves as of this month, and they can't move them, while some nurses and doctors in Canada are still saying they lack proper PPE. Health Canada had announced a Made in Canada change for companies that met the National Institute for Occupational Health and Safety, NIOHH standards, to get Canadian PPE out the door. But so far, this PPE is sitting in warehouses and not in our doctors' and nurse hands because it was not properly communicated that the Made in Canada designation would suffice to local hospitals and healthcare settings. And those settings are still procuring PPE from international, not Canadian companies. Minister, what percentage of PPE procured by the federal government in this date is made in Canada?
Well, thank you very much for the question, and thank you for being there, MP Williams. I've yet to know you really well because you're a relatively new MP. Two things here. First, on the effort, considerable effort and success that manufacturers across Canada have had in procuring all sorts of equipment to Canadians, including, as you mentioned, personal protective equipment and 95 masks, surgical masks, many other tools. So that's the first thing of which we need to be and want to be very grateful for. So thanks for signaling that. The second thing is that as these pieces are delivered to provinces and territories, they're delivered on the basis of what their needs and their requests are. Officials work extremely well together to make sure
Minister, I really appreciate it. Just what percentage right now of Canadian PPE is bought by the federal government, procured by the federal government?
So that obviously depends on all sorts of equipment and particular tools. What I was going to say is that the actual use of those pieces of equipment depends obviously on the demand and the needs of provinces and territories.
Minister, I appreciate that. That wasn't my question, but I don't think you have that answer right now, and I'd appreciate to get that answer. My second part of that is in the communication of the Made in Canada, and at this point, hospitals and healthcare settings don't have that information, and so they're still procuring from international, not Canadian, and this is coming from Canadian manufacturers. What's being done about the communication hurting Canadian PPC manufacturers at this point?
Well, we're doing three things, and as you said earlier, very successfully. First, it was to encourage and support Canadian manufacturers in providing quickly and efficiently all sorts of equipment and tools that we were in need for COVID-19. The second thing we've done really well was to work with provinces and territories to deliver those different tools, pieces, equipments that they were in need during COVID-19. And the third thing that we're doing right now is to invest even more in the domestic capacity, both in terms of research and development and production capacity of Canadian manufacturers.
Okay, thank you, Minister. And what I'm hearing that you don't have those procurement numbers yet, but what I'm hearing from local manufacturers and from across Canada is that they're not able to get their PPE out. And we want to make sure the federal government is buying Canadian manufactured PPE because I think it's very important. So if you could just please put that out, let's make sure we have some communication. I think we want to help Canada be ahead of this, not be average. My second question, Minister, is I know that my colleague, Mr. Davies, has already asked some of this, but Novavax and Medicago offer made in Canada vaccines that are not only innovative, but can help vaccinate the world. The new news from Novavax is they're helping to develop a flu and COVID vaccine, but Novavax is still not approved in Canada. My question to you, Mr. Minister, as we've had $126 million of our money invested into the new facility in Montreal, and Minister Champagne said we'd be producing these vaccines in December, and they're not. When will Canada be producing its vaccines, made in Canada vaccines, sir?
Well, thank you. And here are a couple of brief things. First, it's exactly true that we are so fortunate to have had science in the last 22 months, saving hundreds of thousands of lives. And the contribution to science has been made in part and in large part by companies like Medicago, which is in fact in my hometown.
Minister, when will they be approved?
And of which obviously I am very proud. The second thing is that we need to be vaccinated, and I remind every member of Parliament.
Minister, when will they be approved?
So, and the third thing is that because we need to be vaccinated, each of every one of us, I will turn to Deputy Minister Lucas to tell us more about the approval process for further vaccines.
Well, Minister, I would love the Minister to answer yes. When will the vaccines be approved in the next month?
Well, that is a decision that is obviously made by independent, rigorous, very intelligent, outstanding experts at Health Canada. And I'll therefore turn to Deputy Minister Lucas for more guidance on that.
We're out of time. If it's at all possible to add a couple of brief comments, Dr. Lucas, go right ahead. But if you want to follow up with a written response that's more comprehensive, I'll leave it to you. You have, if you can respond very quickly verbally, go ahead.
Thank you. In regard to the regulatory submissions for Novavax and Medicago, the Health Canada dedicated regulatory teams for each submission are working very hard at these. They are dependent on information from the companies to complete those reviews, but we expect to be making decisions on both vaccines in the coming weeks.
Thank you, Minister.
Thank you, Dr. Lucas, and thank you, Mr. Williams. Next, Ms. Sidhu, please, for 5 minutes.
At home overnight or at their workplace. So finding where to get that buy-in from
$4.5 billion just for mental health investments, obviously in support and collaboration with provinces and territories.
Merci, le ministre. Thank you, Ms. Sidhu. Next, Ms. Kramp-Newman, please, for 5 minutes.
Hi there, and thank you, Mr. Minister, Mr. Chair, honorable members. I appreciate this is a very difficult time for everyone, but years ago when I first started working on Parliament Hill, a fine gentleman once told me, facts, ma'am, just the facts. So this is what we're looking for today. I'm going to switch gears this morning or this afternoon and ask a little bit more specific pointed questions. Mr. Minister, what is the status of the mobile field hospitals that SNC-Lavalin was contracted to produce? And has the company delivered all the units the government has requested, or does the work still continue?
Three things on that. First, this is an example of the significant level of preparation that we did throughout the crisis to prepare for all sorts of eventualities. Second, this is obviously in support to the need and the request of provinces and territories. And third, I'll turn to DM Thompson to see whether we can have an update on that, knowing that that DM Thompson has arrived just a few days ago.
Okay, fair enough. Next question. What is the total amount of taxpayer money delivered to SNC-Lavalin in regards to this particular contract? And are there any outstanding payments that have not yet been made?
Well, this is a PSPC question, so I'll turn to DM Thompson.
Thank you very much for the question. I unfortunately don't have all the details at my fingertips.
If you don't have all the details, sir, we can get them on paper and I can move on to the next question for the minister.
Okay.
Awesome, thank you. So next question for the minister. Why have the field hospitals from SNC-Lavalin not have been deployed during any of the waves of the pandemic? We're in the 5th wave of this pandemic. So what's going on? Have some clarity there?
Well, thank you for the question. As I mentioned earlier, this is an example of a large number of initiatives that my department with other departments, DND, public safety, procurement and public services obviously have done and have supported in the context of a collaboration with provinces and territories. And for further details on the exact nature of the state of that equipment and the use of that equipment, I will turn again to PM Thompson.
No, at this point, I think it's quite clear we're in the 5th wave of the pandemic, and we're unfortunately not getting a lot of clarity with some answers. So I'm going to move on to another question and we'll try. How about this? Did the Minister of Procurement or the Minister of Health sign off on the decision to give SNC-Lavalin a source contract? And did the PMO approve of this?
Thank you. Again, that's a PSPC question, the public procurement and public service and procurement process. So I'll turn to not the doctor, but to DM Thompson.
Thank you very much. So there were indeed two contracts that were established, SNC Lavalin PAE and one with Weatherhaven Global Resources. The total value is $150 million for up to 10 mobile health units each. That's the basic details on the contracting. I would have to follow up on any other details on the current status of that.
Okay, another question with regards to SNC Lavalin. Has the government given SNC Lavalin any other sole source pandemic related contracts?
Thank you for the question. That's again a public service and procurement question, and therefore we'll turn immediately to PM Thompson.
I'm sorry, Mr. Minister, but the buck starts with you and the buck stops with you. And sadly, I recognize that you don't have all the answers to everything, but it doesn't seem like we're getting a lot of answers with anything with regards to the questions that I'm posing today.
Well, I think you're entitled to and deserve to receive accurate answers to your important questions.
I respect that.
Therefore, I think it's important to turn to the right people to have the right information in recognition of the hard work that you've done to prepare those questions.
Indeed. Thank you.
Mr. Thompson?
So thank you. I'm not aware offhand of any other contracts, but I would note that the contracts are all disclosed through proactive disclosure. So that's a relatively easy one just to verify through the disclosed contracts that we have.
Okay, so I guess from here I'm going to move on to a question with regards to travel restrictions, assuming that my time allows it. For the last 2 years, we've been preaching about social distancing, maintaining small groups to prevent the spread of COVID. I have constituents who have been crammed into waiting areas for hours at airports just to be tested, and they're putting themselves in uncompromising positions with other travelers. So what are we trying to do to prevent that?
Short answer, please. That's the time.
Thank you. The first thing I would say that I would say is that this is obviously a very difficult situation for everyone in Canada, meaning everyone would like COVID-19 not to exist. The second thing is that we all need to be vaccinated, and that's a message again that I'm sending to all members of Parliament. The third thing is that now is not the time to travel. We need to do everything to protect everyone's safety and health, and the current circumstances are difficult for everyone.
So perhaps I'll just compliment.
Thank you, Ms. Newman.
Awesome, thank you.
Like, subscribe, and comment, support Canadian media to get the truth.